Welcome to the Spinal Cord Injury Forum. My name is Heather Barnett, and I am a spinal cord injury physician in the Department of Rehab Medicine here at the University of Washington and Harborview Medical Center. And I'm the new director of the Northwest Regional Spinal Cord Injury System. Tonight, we are pleased to welcome two experts in wheelchair seating and the process of obtaining a wheelchair. Jordan Cabrera is a physical therapist and clinical specialist at Harborview Medical Center, and Tracy Smith is an assistive technology professional with New Motion with more than 30 years of experience in this area. Tonight, we are very excited to hear them present on Getting a New Wheelchair 101. Welcome to Jordan and Tracy.
I'm Jordan, and this is Tracy. We know that this is a big topic. It's a very daunting process, as we all know. There's a lot of different factors that come into play when getting a new wheelchair, and it's very individualized. There's a lot of factors such as insurance, home situation, diagnosis. All these factors come into play, and each year it feels like insurance is getting stricter and stricter. So and tougher and tougher. So we know that there are a lot of questions regarding this process, and when we were asked to talk about it, we were happy to do that because we hope that this presentation helps clarify the process and helps answer your questions. So just some disclosures. So I work for Harborview Medical Center as a University of Washington medicine employee, and I work as a PT clinical specialist at the Comprehensive Outpatient Rehab Program, which is the clinic that houses the seating clinic at Harborview. And this is Tracy, who works for New Motion. By the end of the presentation, we're hoping that you will have a better understanding of the wheelchair process, and you'll be able to describe what happens before an appointment, during a wheelchair appointment, and then afterwards. We want to make sure that you know the correct team members are involved with the process, and then know what to do afterwards if you have any issues with your wheelchair. So how our presentation is organized, we split it up into 3 different sections. The first section will just be what happens before the evaluation, and then the second section will be what happens during, and then the third section is what happens afterwards. So pretty simple. We'll go, like in this outline, we'll go through each individual section. So, when we started, when Tracy and I started practicing this presentation, we thought it was very dry and very dense. So, we wanted to kind of change the format a little bit and make it more dynamic, so it's easier to digest. So, what we're going to do is we're going to actually make it like a Q&A, question-answer type format, where Tracy and I are going to ask each other questions. And then with the answers, we're hoping to go through all the material from our presentation. All right. So the first part of the presentation will be what happens prior to a wheelchair evaluation. So Tracy's going to start off by asking me some questions.
So Jordan, if somebody needs a new wheelchair, what is the first thing that they should do?
Well, the first thing they really should do is talk to their medical provider about their need for a new wheelchair, or about their issues with their current wheelchair. When I say medical provider, because it does not have to be a doctor. It can be a doctor, so it could be a physician, which can be a medical doctor, MD, or a DO, a doctor of osteopathic medicine. It could also be a nurse practitioner or a physician assistant. So any of these healthcare workers can sign the paperwork for your wheelchair. But what I would really suggest is that you find someone that will be there for you, to sign paperwork and who will advocate for you. Because as we know, this is a huge process, and we want someone who's responsive and who will be there to sign your paperwork. And for example, if your wheelchair gets denied, we want someone who can help advocate for you if it needs to be appealed, things like that. So whoever it is, it'd be good to have someone who knows you and who will be there for you throughout the whole process.
So what kind of providers should they see?
So typically, the best provider probably would be someone who's a rehab medicine specialist. Again, that could be still a physician, a nurse practitioner, or a physician assistant. Just rehab medicine providers tend to have more experience with getting a new wheelchair and they work more closely with PTs and OTs. So if you currently see a rehab medicine provider, that would be the best route to go, especially someone who specializes in individuals who have neurological injuries or who specialize in spinal cord injury. If you don't have a rehab provider that you see normally, then talking to your PCP, a primary care physician, or your general medicine practitioner, that's fine as well. And the PCPs, their specialty tends to be internal medicine or family medicine.
Is there another name for a rehab doctor? I hear some people call them psychiatrists, podiatrists. It's very confusing.
Yeah, that's actually a common question I hear a lot too. So a rehab medicine provider is also, or a rehab medicine doctor is also called a physiatrist. So their specialty is called physiatry. So they're not podiatrists. Podiatrists are doctors that specialize in feet. And then a psychiatrist is someone who works with patients for psychiatric patients. So yeah, so they're called physiatrists. So that's the same thing as a rehab doctor. Sometimes they're also called PM&R doctors. PM&R standing for physical medicine and rehabilitation. Good question.
Mm-hmm. Can you explain the face-to-face visit and when it happens and when they see their doctor? More about what happens when they see their doctor?
Yeah, so I'll talk a little bit more about this, but in general, when you talk to your doctor or your medical provider, you usually need to see them in person. That's how historically it's been. So in the past, Medicare, they coined the term face-to-face, meaning that you're seeing the doctor in person. And back then, it used to be mostly for cases when you need a power wheelchair. But nowadays, you pretty much need a face-to-face or doctor's visit with for any type of wheelchair or any wheelchair component. So it can be. So typically, it's done in person. Nowadays, with the pandemic, telemedicine is a lot more popular, and so telemedicine appointments do count nowadays. It has to have video though, so that's what makes it count as a telemedicine appointment. If you have a phone visit with your doctor, like you just talked to him on the phone without video, that would not count. Or let's say you just chatted with your doctor on like a electronic medical record system like eCare or MyChart, that wouldn't count either. So it would have to be either an in-person visit or a telemedicine visit. And so pretty much, for any need, a lot of insurances require this appointment and then requires that you see the doctor within a appropriate time frame. So typically within 6 months. In terms of the face-to-face visit, what will happen when you see your doctor will write medical documentation for this visit as an office visit note, and that is what the insurances want to see when it's submitted to your insurance. And so in the office visit note, your medical provider will need to talk about your need for a wheelchair, your clinical conditions, any pertinent medical diagnoses you have, and how you currently move around in your home. How you currently move around, especially in your home. And so that's what's needed in addition to all the other things that the therapist will do when you ask for a new wheelchair.
Mm-hmm. At this appointment, does the doctor need to write a prescription for the wheelchair?
So that's a common misconception. Your doctor does not need to write a prescription for the wheelchair at that time. That will happen later on after you see your therapist, and then your doctor will co-sign that a prescription later. But actually, at the face-to-face visit, your doctor will need to submit a physical therapy or occupational therapy referral. So referral, not a prescription, to a seating or wheelchair clinic. And then so once that happens, then you'll be put in a queue or a line to be scheduled with a seating clinic. There may be times when you see the doctor after you see the therapist. So that can happen sometimes. An example of when that happens is when, let's say you're seeing a therapist for regular physical or occupational therapy, and then during your therapy sessions you identify a need for a wheelchair. So, and that might be a case when you would see a doctor afterwards. But in most cases, you typically talk to your doctor first.
So where do wheelchair appointments happen?
So they happen in a seating clinic, and I know I said that earlier. So a seating clinic is the same thing as a wheelchair clinic. They're interchangeable. So it just really depends on what facility you're going to. And so pretty much a seating or wheelchair clinic is an outpatient clinic or outpatient service that has physical therapists and occupational therapists there that evaluate individuals for seating and mobility needs. And so, most practices that specialize in individuals who have neurological conditions have some sort of service. They should have some service within their clinic for wheelchair seating. If they don't, then a lot of times you can ask them where they should go. And then just so you know, so if it's not your first chair, typically it happens as an outpatient basis in a clinic. But there may be times when you might have a wheelchair evaluation in the home with a home health therapist. If you're homebound, it could happen in a skilled nursing facility, which is also known as a SNF. If you're living in a SNF, and if it's your first chair, then it might happen in inpatient rehab. But in general, most of the times, if it's a subsequent chair, it typically happens in an outpatient basis.
And how does somebody get an appointment with the seating clinic?
Yeah, so I mentioned earlier, your medical provider should send a referral to a seating clinic. If the seating clinic is within the system that your provider is in, then often it happens electronically, so they can just send that electronically to their seating clinic. Sometimes, if it's not, then it can happen through fax. But typically, once the seating clinic gets the referral from your doctor or from your provider, then you'll be put in a queue to be called to be scheduled for an appointment with a therapist.
And so when the scheduler calls, I know that they ask the client a lot of questions to help us prepare for the appointment. Jordan, can you go over the questions that they're asked?
Yeah, so it's really important that that we're prepared for your appointment. So that's why we often will ask a coordinator or scheduler to call you beforehand to ask you questions about your situation. So these are just some common questions that we will ask. Just so we're prepared. We'll likely ask you what the age and date of purchase of your current wheelchair is, the make and model of your current wheelchair, what insurance paid for your wheelchair, do you have any current issues with your wheelchair, do you need your wheelchair inside your house, inside your home, does a wheelchair fit in your home, can you get into the bathroom, can you even get it inside your home, like is there a ramp, or does it have level entry, are you currently working with a wheelchair clinic, or have you had one in the past? And also, we'll also ask you if you have a preference on a vendor. So a vendor, I'm saying vendor, that's pretty much a wheelchair supplier. So it's the wheelchair company that is supplying your wheelchair, because the hospital or clinic that you're seeing is not the ones providing you with the wheelchair. So when I do evaluations, Harborview is not providing my patients with the chair. It's actually the wheelchair company that is. At Harborview, we're providing the clinical documentation and evaluating you and prescribing a wheelchair, but the vendor is actually the one who's actually supplying it, and they're actually in charge of repairing it afterwards as well if there's any issues. So when you're thinking about what vendor you want to make sure that you are choosing a vendor that you trust, and also that where they have a repair department that services your area, because you want to make sure that repairs are convenient for you if you ever have any issues in the future. All right, so now we're going to switch gears, and Tracy is going to be on the hot seat now. All right, so Tracy, what are some of the general guidelines that qualifies someone for a wheelchair?
So the general guideline for somebody to qualify for a wheelchair is a limitation that impairs their ability to perform one or more mobility-related
else.
activity of daily living in their home. And so a mobility-related activity of daily living consists of eating, bathing, dressing, toileting, or grooming. So if just one of those is impaired, that would qualify them for a wheelchair. And if it's the least costly alternative. And then they also need to have a clinician that will support the need and rule out less costly equipment.
Right. Tracy, who qualifies someone for a replacement wheelchair?
Well, when their current wheelchair no longer meets their needs, such as a change in condition or their chair is beyond repair, and like a change in needs would be like weight gain, or if they're like over the weight limit of the chair, or a significant change in condition like a diagnosis change where they no longer have the ability to operate their chair.
Yeah, like let's say someone had a spinal cord injury and then if they had a stroke afterwards, that would be a big change. Or maybe
Right.
if someone had, has multiple sclerosis and it's
Right.
gone worse, that could
It's
be
progressed and they no longer could
Mhm.
drive their chair, say.
Yeah.
If their wheelchair is lost due to catastrophic disaster, such as a big fire, flood, hurricane, or if it was stolen, which would require a police report.
All right. Do insurances pay for backup wheelchairs?
Most insurances do not pay for backup wheelchairs, but if the primary chair is unable to be transported in the family vehicle, we do sometimes have success getting coverage.
Okay, great. All right, so that's the first section of our presentation of things that happens before a wheelchair evaluation. So now we're going to talk about what happens during the wheelchair evaluation. So once you're at the appointment. So Tracy's going to ask me some questions.
So Jordan, who should be at the wheelchair evaluation?
So definitely you should be at the wheelchair evaluation as a patient, and you definitely should bring your wheelchair, your current wheelchair, because we'll want to see it and assess it. Also, it'd be important to bring your caregiver or a family member, anyone that's involved with your care, because they may have a lot of good input that they can share, and also they will they know a lot of the things that you go through on your during your daily life. So you got the patient and the caregivers will meet with a therapist, so a physical therapist or occupational therapist. Again, either discipline can do wheelchair evaluations. And then there'll also be an assistive technology professional, ATP, from the wheelchair company. And so an ATP is just a certification that someone can get. It specializes in assistive technology. And then someone who gets an ATP has taken a test for that and also has had a lot of experience in AT. And so someone from the wheelchair company will have the ATP, but also therapists themselves can have ATPs as well. But as long as one person in the team has it, that's what's most important. And then, so you'll meet with us during that appointment.
Mm-hmm.
What's the next?
So what happens
question?
during the wheelchair evaluation?
Yeah, so during the wheelchair evaluation, we split the evaluation into 3 different phases, and which we'll talk about more closely. We'll focus on more in our next few slides. But essentially, the first thing you'll go through is a therapy evaluation. So if you've had PT or OT before, you typically have a therapy evaluation for your first session. So it's kind of the similar type of appointment for that. And then once you have a therapy evaluation, then you'll do wheelchair equipment trials where you'll trial different demos. You'll get in the demos hopefully and see what works best for you. And then the last part is a wheelchair spec out, and we call it spec out because that stands for specification. So we're deciding, exactly what we're gonna, what type of chair you'll get and all the different details. So we're dialing it in for you, and all these wheelchairs are custom built. So then, and they're all individualized. So that's why that's a big process.
Is this all done at one appointment?
Yeah, it can be done all at one appointment. Like at Harborview, we like to do it at one appointment if we can, and it does typically take a longer appointment. Sometimes it can be, it could also be split up in several appointments. I know it really depends on the clinic you go to. Some clinics will have you see the therapist first, and then the next appointment the therapist will have the vendor come. Sometimes it happens all together, or sometimes it may be split into several appointments because you may want to trial equipment or bring it to your home to make sure it works and all that stuff. So it really depends on the situation.
What does the therapist evaluate during the session?
It's a good question. Yeah, so I'm going to talk a little bit about that since that's what I do a lot. So what will happen first? As I said, the therapy evaluation is something. It's pretty typical to like what you would go through when you have regular physical therapy or occupational therapy. The first part will be kind of more of a clinical interview. We'll ask you a lot of questions. Some of the questions will overlap with what the scheduler or the coordinator called you about over the phone. But then, the therapist will ask you in more detail because this is what we need to document in our notes, in our letters of justification for the wheelchair. So we will ask you, about your home environment, what your living situation is, how your home is set up, and if making sure your home is wheelchair accessible. Do you have caregivers? If so, how many hours per day? How many hours? Or per week? What is your current, what is the current way you do your activities of daily living, your ADLs? How do you store your chair? How often? How long you're in the chair throughout the day? We'll also ask about your community participation. So, do you work? Do you go to school? What type of recreational activities do you do? We'll also ask about your transportation. How do you get around? Do you have a wheelchair accessible van? Do you have like a car? Do you drive with hand controls? Do you like transfer into the car on your own and you take the car apart and put it into your car? Or you take the wheelchair apart and you put it into the car, things like that. So we'll want to get to know that because that's going to make a big difference in the type of wheelchair we'll order for you. We'll also check your cognition, your communication, your vision. Do you have visual impairments that will affect your ability to drive or propel a wheelchair? We'll ask about your pain levels or where you have pain. Pain is really important to talk about with your therapist just because we may use that information to justify certain components of the wheelchair. We'll definitely want to see if you check if you have current skin issues. Do you have a current pressure injury? Do you have a history of a pressure injury? Because that's going to affect the type of equipment you can get. We'll also ask about your current wheelchair system, like the age, your current issues with your wheelchair, like what do you like about the chair, what you don't like about it, because definitely if you don't like something about your chair, we definitely want to change that for your new chair. And then we'll also ask about your pressure relief method. We all know pressure relief is really important when you're in a wheelchair throughout the day. So the type of wheelchair, the type of pressure relief is going to make a big difference in what we can justify for your chair as well. So then once we get that out of the way, we'll do a clinical examination, and we'll look at, we'll examine your muscle strength, how well do your arms and your legs move, your sensation, since not having sensation increases your risk of a pressure injury, so we definitely will be checking your sensation. We'll be checking your range of motion of all your joints. We want to make sure that, especially in your hips where you're sitting in the wheelchair, we're assessing to see that you have enough movement in your hips to bend enough to sit in the wheelchair. We'll check your coordination. Do you have enough coordination to propel your wheelchair or to drive a wheelchair? We will assess your tone. So do you have spasticity? Because we all know spasticity affects your positioning in a wheelchair and your ability to drive a wheelchair. We'll check your balance. Do you have enough balance to sit in a wheelchair? And if not, we want to see what type of supports you need in your wheelchair to accommodate your balance. And then if you do stand, some people who have incomplete injuries or who have hemiplegia, we will assess your standing if you can. Then we'll check your functional mobility. We'll do a functional evaluation. So we'll look to see how you move in bed. Can you roll and get up from bed? We'll check your transfers. Yeah, we want to make sure that you can get in and out of your wheelchair. We'll also check your wheelchair skills. So how do you move in a wheelchair? Like if you're a manual wheelchair user, how do you propel? If you are a power wheelchair user, we want to see, do you use a joystick? Do you need a special handle for your joystick to grip the joystick? Do you drive with alternative drive controls such as sip and puff or head array? So we want to check that. And then we'll also check, like if you are able to walk, we'll check the walking ability as well, because that will affect what we can justify for you for your wheelchair. We'll also check your measurements. So we call that anthropometric measurements. So that's pretty much the measurements of your body. So these are just, on the slide, these are just examples of, or this is pretty much all the measurements we would take. So we would check how wide are your hips, how long are your upper legs, how long is your lower leg, how wide is your chest and then your shoulders, things like that. We'll need to know your height, and we'll also need to know your weight, just because we want to make sure whatever we order for you, that you are within the weight capacity of that wheelchair. Then we'll get into the postural evaluation. So that's a big part of the assessment, because obviously we want to make sure you have good posture in your chair. So the postural evaluation is often called a mat evaluation by the therapist. And so it's called a mat evaluation because we typically want to get you out of the wheelchair if we can, and we want to get you on the mat to see your postures in different positions. So when we do a mat evaluation, we'll assess you in 3 positions. The first position is sitting in your current wheelchair, right? Because we want to see what type of supports you have in your current wheelchair and how you're sitting in that. And then we'll get you on the mat and then and have you sit at the edge of the mat. We call that short sitting. And so at the edge of the mat, we want to see what gravity does to your body. When you don't have all the supports, do you have any postural asymmetries that can cause you to sit in a certain way? So again, we're looking at what gravity does to your body, and we know. I know there are a lot of people who can't sit by themselves at the edge of the mat. So then we may have a therapist hold you, or we may have an assistant or an aide hold you as well while the therapist evaluates your posture if you can't sit by yourself. And then we'll get you on your back, lying on your back on the mat, and that's called the supine position. And then what we're seeing now is we're seeing what happens to your body when gravity is eliminated. So the point of that is to see to check to see if we're seeing any postures that are fixed, meaning they're stuck, or if they're flexible, meaning correctable. So can we move? If we're seeing a postural asymmetry, are you stuck that way, or can we correct you? And do you have that flexibility? So that's why we want to see you in all those 3 positions. And so with each position, we're looking at you from 3 angles. We're looking at you from the front, from the side, and from the back. And so we want to just get a full 360 view of how you're sitting, and then we'll examine you from throughout your whole body to see your posture. Typically, therapists like to we usually start in the pelvis and then your trunk, and then go from there, either down to your legs and to your arms. But but that also depends on the situation. And then these pictures are kind of just of us doing checking how flexible you are, checking if your postures are fixed or flexible. So when you're on your back, where gravity is not a factor, so we're moving your joints, especially your pelvis and your trunk, to see if we can either correct the asymmetries or if they're stuck. Some examples if they're stuck is because if someone has a contracture and a lot of times that won't move anymore. Or let's say someone had hardware from a surgery put in their body, so that will make it so your spine may not be totally neutral. Yeah, and so what the therapist wants to know is we're gonna, if something is fixed or stuck, then we are accommodating to that because we're assuming that we're not going to be able to change that. So we're figuring out what we need to do to the wheelchair to accommodate. If something is flexible, then we will use postural supports to put you back into the middle. So we'll call that midline. So in the neutral position, because we want you to sit in the middle as much as possible. So now I'm just going to talk about some just common postures we look at. So starting at your pelvis, sometimes we'll look at if you have a pelvic obliquity. A pelvic obliquity is when one side of the pelvis is lower than the other side of the pelvis, like in these pictures here. We also may look at if you have a pelvic rotation. A pelvic rotation is when one side of your pelvis is more forward than the other. So this picture of the pelvis is like coming from the middle. Actually, the middle picture is coming from the top down, looking down. And we'll also check if you have a pelvic tilt. So our pelvis tilts forward or backwards, and so like in that picture here, so we want you to kind of be somewhere in the middle. That's ideal. When someone has a posterior pelvic tilt, we call that often people end up sacral sitting, and that's like how it is in the picture there. And sacral sitting isn't great for your posture, but it's also bad for your skin. So people who sacral sit a lot have a higher risk of skin issues on their coccyx and on their sacrum. So that's why we're looking for that. Moving on to the trunk. So if someone if someone's spine kind of curves laterally or to the side, we call that scoliosis. So we'll check for that. We'll check for a thoracic kyphosis. A thoracic kyphosis is when your upper back kind of hunches forward. So we'll look for that. We'll also look for a lumbar, if you have lumbar lordosis. So what that is does your spine curve inward? And so we want you kind of somewhere in the middle. So we'll assess for that as well. Then we'll move on to the rest of your body. So we'll check your hips. Are your hips abducted? Abducted just means that your legs are kind of out to the side. They're splayed out. Adducted is when your legs come in. We'll check if your legs are windswept. Windswept just means that your legs kind of go to the side, either to the right or the left. We'll check to see if you have excessive ankle plantar flexion. So plantar flexion is when your toes point downward. And if that's a very common contracture. So we're checking to see if do your ankles or flex enough for your feet to kind of sit flat on the foot plate. So so that's why we're assessing that. And if not, we may need to accommodate to your ankles. We're also checking to see if it moves inward or outward as well. We're assessing your head position too. Does your head stay neutral? And then we're also looking at if there's any other joint restrictions in your arms and legs or the rest of your body. Okay. Yeah, I know that was a long-winded explanation, but that's pretty much what the therapist assesses during that appointment. Mm-hmm. All right. So Tracy's going to talk about the next phase of the appointment. And then where we're talking about, we're doing the equipment trials, okay? So we're getting you into the demos. So yes.
So most wheelchair seating clinics have trial equipment. And if we know ahead of time what the client is looking for, we can try to have that equipment available for the appointment. Less costly equipment needs to be ruled out, so we may need to have the client try less costly equipment for the therapist to document the outcome measures. If there are concerns about the equipment working in the client's home, we may have a technician or the ATP bring the chair to the client's home to confirm if it fits in the areas that need to be assessed. Having a caregiver or family member present for the evaluation can be helpful to make sure we're not missing anything that we would not see in a clinic setting.
All right. Sorry. Next slide. So let's look at some equipment considerations, right, Tracy?
Yep. So we're not going to talk about basic lightweight chairs because they do not require a seating evaluation as they are not custom. But if we look at ultralight chairs, there's folding ultralight chairs that fold side to side. There's rigid chairs rigid ultralight chairs that fold front to back. And then there's tilt and space wheelchairs that really don't fold. They're not very transportable in a vehicle, except for if you have like a van, you have to really break them down to make them transportable.
And those are mostly for people who don't really propel on their own or
Right.
Can't do a pressure relief on their own, right?
Usually and they usually ride in the chair if they're going to be transported. So the kind of questions that we ask to try and determine what kind of chair somebody would need is we ask them whether they need the footrest to swing away for transfers. We ask them if they're a full-time chair user, who's breaking down the chair for transport, do they need seat slope, center of gravity adjustment, do they need camber, is the client dependent or are they independent using the chair?
And who's breaking down the chair, right?
Right?
Yeah.
Who's breaking down the chair? And then for accessories, next slide, we consider what accessories are needed, like casters, propulsion wheels, hand rims, side guards, and the most important thing is color.
Yeah, because people want to look good in their chair, right? So really important.
That's right. So for cushions, we take in consideration diagnosis, comfort, ability or inability to weight shift, their current or history of pressure sores, and any postural asymmetries.
All right. And then backs. Yeah.
For backrests, we look at back height, how much lateral support is needed, like how much hug you want from the back support to help position the person in the middle, and the need to add head support. Again, postural asymmetries. Think about all the things that Jordan talks about that he assesses during the mat eval. If someone's seating is hard to address with off-the-shelf cushions and backs, we may introduce custom molding as an option to try to accommodate their position.
Great.
So power assist, this is something that could be added to a manual chair. So power assist can be part of the wheel or it could be added to the back of the chair, and it can keep the chair still a manual chair but having power added to it. Most insurance companies don't pay for it unless the person has been using the manual chair for at least 1 year. So for power chairs, they range from basic power with the captain seat that are primarily used for patients with respiratory issues and or arthritis issues, to power chairs that have the ability to tilt and recline, have power legs, and even have the ability to stand.
Yeah. So then that's the phase of the equipment trials, and so the last part of the last phase of the appointment is the spec out. So again, that's when we're dialing in everything, and once you've decided what works for you, we want to make sure we're ordering everything based on you as an individual.
Right. So once we know what we're ordering, if we're ordering a manual chair, power chair, folding, rigid, tilt and space, mid-wheel drive, rear-wheel drive, front-wheel drive, then for manual chairs, we try and figure out if we're going to order, what we're going to order for the front frame angle, the front and rear seat to floor height, the seat width and depth, the frame depth, the back height, the back angle. For power, we're trying to figure out what power functions are needed, what hand control, do we need alternative drives, transfer style, suspension, how the chair is going to be transported.
Yeah, it's a lot of stuff, right? So it is definitely a process, and that's why we go through it very thoroughly with you to make sure it meets your needs. All right, so then our last section of our presentation is talking about what happens after the wheelchair evaluation. So yes, so Tracy's going to start off by explaining that.
Yeah, so after the appointment is, after we've done the whole spec out, then a quote is sent to the therapist to write a letter of medical necessity, justifying the wheelchair and all the components. That letter is sent with a detailed prescription to the ordering provider to sign and concur with the recommended equipment. It's helpful to let your provider know to expect these documents.
Yeah, and that's why you want someone who will be there through the whole process to help and will be responsive to any paperwork that's needed.
Right. And then once all the documentation is received by the vendor will submit to the insurance company for prior authorization, and if approved, will contact the client to discuss any coinsurance due before ordering the chair. If the insurance denies, the vendor will work with your provider and therapist to submit an appeal. You can always advocate by calling your insurance.
Okay.
So,
great.
Yeah, so Jordan, once the wheelchair is approved and ready for delivery, what happens?
Yeah, so the wheelchair company will let the seating clinic know that the wheelchair is ready, and then you'll likely get a call that, and a scheduler will schedule a final fitting appointment. And so that's typically done at the clinic. Some clinics do it differently. Some clinics will have the vendor bring the wheelchair first to their home before you meet with the therapist. At Harborview, we tend to do the fittings in the clinic all together as a team, because everything, right? It's a team. We want to do a team approach because we're all working together to get your wheelchair. And so at the day of the fitting, you'll meet with the therapist, and you'll also meet with the vendor, the wheelchair vendor. So the wheelchair vendor, it could be the ATP that you worked with in the evaluation. It could also be a wheelchair technician from the company. And essentially, what else? You also want to make sure you bring your caregiver or your family member that's involved with your care to this appointment as well, because we're going to be working with them during the appointment for education, things like that. So what will happen during the appointment? The therapist and the wheelchair vendor will make sure that the wheelchair is fitted properly to you. We may order whatever during the wheelchair evaluation, but then we don't really know if it really works for you or fits you until this appointment. So we want to make sure that it fits you, and that and we'll make any adjustments needed to make sure that you have optimal posture and you have optimal function. And again, the therapist and the wheelchair vendor will perform education. So we'll perform education with you, but also with your caregiver or family member, just to make sure you know how to use the chair, especially if it's a new type of chair you're getting, and also how to maintain the chair. The fitting typically takes about 1 to 2 hours, depending on how many adjustments are needed to the chair. So just expect to be there for a little bit. And then at the end of the fitting, if everything's good, then you usually can take the wheelchair home that day if you have transportation. If not, then the wheelchair company can actually get it delivered to your home at a later date, if that works better.
So Jordan, if a patient has a problem with their wheelchair in the future, what should they do?
So in the future, it depends on what the problem is. So if the problem is more of a replacement or a repair, so let's say something's broken on your chair and needs to be, you just need the same thing that you had originally, or let's say something's breaking down or not working, like the batteries aren't working, things like that, then you would call the vendor, the wheelchair vendor's repair department. As I said, the vendor is in charge of repairing your chairs if there's any problems, and your insurance does pay for wheelchair repairs. So then the vendor themselves, they can send paperwork directly to your medical provider to get things signed, so insurance will pay for it. If you're noticing more clinical issues, examples of this could be like skin issues from the new wheelchair, positioning issues, functional issues, or like new pain that you're getting from the wheelchair, things like that. you would want to contact your therapist at the seating clinic. And then we can assess what's going on and then see if we need any modifications to your wheelchair. Just to warn you, if it's been a while since you saw your therapist, let's say it's been like several months or so, or there's a really good chance that your therapist probably discharged you from therapy. So that if that's the case, then you may need to first talk to your medical provider and get a new referral for another wheelchair evaluation to see the therapist beforehand. All right? Yeah, so I guess that's all the material we have. I know that was a lot of information. Hopefully we kind of clarified the process. But if you have any questions, we'd like to take those now.
The first question, I live in a state where Medicaid doesn't pay for wheelchairs if you live in a nursing home. What can I do? Any insight into insurance in skilled nursing facilities and how people navigate wheelchair prescriptions in general in that setting?
Yeah, so a lot of, most skilled nursing facilities have therapists who work at the facility, hopefully. I know some skilled nursing facilities are better than others, but then it's really important to get the therapist involved at the nursing home to get them to support your need for a new wheelchair and also the doctor or whoever's for senior care. But it is difficult because it's based on insurance. Right, Tracy? So at least in Washington State,
I'm assuming that's a therapist asking that question?
It might be a patient with a spinal cord injury, I think. And if that person wants to have any follow-up, let us know. I know that we sometimes have some issues with power wheelchairs in skilled nursing facilities here in Washington State, but it may also depend on the state. It sounds like this person's not in Washington State.
Right. Probably contact the donation place, right?
Yeah.
I mean, if you're a patient and you live in a nursing home and you don't have coverage for a wheelchair, right, from your insurance, because it's state insurance, I would contact a donor closet to get a power wheelchair or whatever kind of wheelchair we're talking about.
Yeah.
Right. I think that there's wheelchairs out there that are available. I think that people get wheelchairs and they donate them, and they're just available.
Yeah, and that may depend on the location where they could find I don't know that we have connections with all different states, but you're also welcome to email us to give us more information if you'd like. Yeah. There's been some discussion in the chat, but I will read the question and the follow-ups. So this person says, I'm a T12 para from a 2014 snowboarding accident. The wheelchair Harborview spec had new motion build for me is great, but it's wearing out. I now have zip ties, rubber bands, and duct tape holding some parts together. My current insurance company says that after it breaks, I can try to schedule an appointment with their approved repair shop or find someone to bring the wheelchair to them, and they'll fix it or order a new chair for me if it's not fixable. And in the meantime, I simply lay in bed for however many weeks or months it takes. Is that usual, or is there something I can do to avoid the impending disaster? And I think there's some discussion in the chat that this is a little bit insurance dependent.
Yes. Yeah, it is.
But, I mean, 8 years old would be pretty shocking if they wouldn't replace a chair at 8 years.
Yeah.
For a para.
Yeah, most, I would say, sounds like you should probably talk to the Harborview Therapy Clinic or your physician at Harborview to figure out if you could get a new chair.
Well, I would first you probably should talk to your medical provider first, and then discuss that, and then the medical provider can refer you back to Harborview to the seating clinic.
Yeah.
And then the therapist can assess it and then work with the vendor to help advocate for a new chair. Especially if it's been 8 years. Typically most chairs, they tend to last around 5 years or so. But yeah, that would.
Yeah, for a lot of people, the window is 5 years. A lot of insurance companies will pay for a new wheelchair approximately every 5 years, but that likely does depend a little on the insurance.
It kind of needs to be greater than 5 years.
Yeah.
Like they pretty much every insurance says don't talk to us until it's been 5 years.
Yeah.
And then they want to see a repair quote that it would be more cost effective to replace the chair than to repair it. When you get into an ultralight by a para, now that's a little bit different. When you get into 7 years on an ultralight, I think that you could say that the parts are probably wearing out, they're probably rusting. I think that I'm pretty sure that that's not going to be a problem to replace a 8, that's 8 years old probably, but say it's 7. I think that one is probably going to be able to be replaced without even a repair quote.
Yeah, I think everybody's comments are kind of that ideally seeing the medical professional, someone at Harborview if you're already connected, and let us know if you're not, to start the process of getting a new chair. If your chair is held together with duct tape and zip ties and those things that people often have to do, then I think you should be able to find some medical professionals to say that your chair is not functional in its current status. Mm-hmm. So hopefully we can help you out, but let us know. So the question was, how often or what should bring you in to ask about a new chair? Do you guys want to take that one?
Well, yeah, I mean, if your chair is not meeting your needs, if there's things that's going on, that's a big factor, like Tracy mentioned earlier in the presentation. Yeah, and then if there's wear and tear, like if it's approaching that over 5-year mark, and and then you're getting it repaired, and then the vendor's saying that it's going to cost more to repair their chair than replace it, that's a big sign. I don't know, what else, Tracy?
Yeah, well, I think like if you've like put on weight and you're having a leaning issue, and
like your posture's not good.
Yeah, and usually the doctor will, you see your doctor, and the doctor notices maybe you need to see a therapist, or you're having pain because you're leaning, you're having skin breakdown because of maybe you're leaning, and so maybe they send you to a therapist, and the therapist says, maybe we need to look at a new chair for you. I mean, that's one thing that sometimes the therapist will initiate that you need a new chair. As far as whether the client, if they think they need a new chair, it needs to at least be 5 years old before they should think that they need a new chair.
Unless it doesn't meet your needs.
Or it's broken.
Yeah, or it's broken, yeah, unless it's broken, yeah.
Yeah.
But then if it's broken, a lot of times
if it's broken, the repair shop, the repair people will see if they can fix it.
Yeah, so it sounds like approximately every 5 years in terms of time frame. And then if you think something is broken, get in with somebody to see if it could be fixed or if you need a new one. And then if there's something that's not working with the chair, either pressure injuries or mechanics or pain,
clinical,
something like that. The question was, can we talk a little bit about the denial and appeal process?
So that's also insurance dependent as well. Some insurances will do what we call a peer-to-peer, right? Where you can there may be a time frame where the medical provider can just call the insurance company and talk to the medical provider on the insurance side and discuss that they really do need the chair even though it's denied. sometimes it could be in the form of a letter, and where the therapist can be involved and work with the medical provider to appeal the decision. So, yeah, it really depends on the insurance, and even for me, sometimes I have to read the denial letter, and I have to touch base with Tracy about what exactly we need to do, because it really depends. And even within a certain insurance, it depends on the plan that you're in as well. So it's not super cut and dry.
Yeah. Does that answer the question, Chris? I think it's of course very difficult, but keep in close contact. It sounds like with the seating clinic and maybe your provider if you to deal with the next steps of that. The question was, do we ever have luck with appeals process and denials and getting the denials overturned? And it sounds like yes, absolutely.
Yeah, especially if you have someone who will advocate for you and who's willing to, a medical professional who's willing to write the letter of justification or is willing to do the peer-to-peer phone call. There's a lot of success.
I think we usually only have luck with rehab doctors doing it. It's really hard to have a general doctor appeal a wheelchair.
Just because, PCPs or general doctors don't do this as often, so they don't
It's pretty hard to
know.
appeal a wheelchair if you don't, order them.
And sometimes there's a quick turnaround time to do this. So, rehab doctors just tend to are more familiar with this, so they know the process. Versus some PCPs may, need some coaching about what to do, so it's a little more difficult sometimes. But you never know. But there are some PCPs that do really well with it.
I've never seen one get one. I've never seen an appeal get approved by a PCP.
Yeah,
So
I think the
only
appeal
a rehab
process.
doctor.
It sounds like there's some good success with getting appeals approved, but that you need some good specialist support. And that is one of the things I think, Jordan, you mentioned earlier that seeing a rehab doctor may be helpful because the exact wording that the insurance company wants may already be something that doctor has dealt with before. And sometimes if it's a primary care doctor, they don't know the exact phrase that will get you what you need.
Yeah, definitely.
That being said, sometimes everything goes through smoothly, I assume.
Yeah.
Oh, yeah. Oh, yeah, most of the time. Most of the time.
Great. This person says they have a manual chair. I have a car that the new motion doesn't fit. Could they cancel their order, or if not, what is the smallest, most useful wheelchair? Or I guess in general, how do you deal with fitting cars and getting a wheelchair into a car and figuring out troubleshooting that?
But you're saying the order was already done?
Maybe can we and we can kind of pend that question too. Maybe if I'll send a message in the chat.
I mean, ideally, that's kind of why the therapist asks all these questions beforehand, because we want to make sure that before it's ordered, it does fit in your home, and that's why you hopefully have tried the chair, and so.
She says it is in production.
Yeah. And then what's the question exactly? What to do?
Yeah, what to do if it's and she said no one had asked her about the size of the car when they got the.
Yeah. So I think what you should do is get in contact with your therapist who ordered it, or the vendor,
Okay.
and try to see where it is in the process, and then maybe there's opportunity to modify the order or get reassessed for something different.
That sounds good. And a couple of comments. So someone's mentioning I would advise people to always have a backup chair. If you get a new wheelchair after 5 years and the old one is still usable, keep it.
Yeah.
So that's great advice.
Yeah. Whatever all your old chairs, like when you get a new one, insurance is gonna, or like we're not gonna ask for the old one back. So definitely, we always tell our patients to keep it as a backup if they can. If it's safe, if it's usable and
Yep.
safe.
Or another option for that, I keep my old chair and pillage parts from it. When one of my brakes or a caster broke, I took them off the old chair. So that's another use for it, even if it's not totally usable, maybe some pieces still are. And then again, mentioning if you can, try to figure out if you can transport it in your car before you get it, was another comment.
Thanks everyone for joining in, and hopefully you found this interesting.
Great. Thank you both very much, for you guys. So thank you so much to both Tracy and Jordan for being here and sharing their expertise. I think that was really informative, and I think we had a lot of good discussion. That's all we have time for now, and we will see you all at the next forum. Thanks.